Thank you. We hope to convince you today that one of the most important diagnoses you'll ever receive is the causal pathway on your death certificate. And the reason why that matters is that in aggregate, death certificates tell us a lot about the health of our communities. They're used by researchers to help find cures for diseases like cancer. They're used by policymakers to try to better understand health disparities and how best to address them. And they're used by public health responders during times of public health crisis, so they know how they can best improve the health outcome of our communities. Now, just to give you some intuition around why these data are so powerful, I'm going to show you a series of slides that date back to the early stages of the drug overdose crisis in our country. And as we flip through them, you'll see where it started, primarily in Appalachia, and how it spread throughout the country. And it was no longer just this hot spot, and how it continued to grow. Until where we are now. The other reason why these data matter is that we're able to look at disease trends not only in space and time, but also the textual information that's written on death certificates gives us a great deal of insight about what's driving these numbers. So here you can see that in the early stages of the drug overdose epidemic, it was primarily prescription drugs, and methadone played a large part in it. And one of the most important public health interventions that happened was that Medicaid changed the formulary, so that way methadone wasn't as commonly prescribed. And you can see through the national statistics data how that made an impact. But tragically, the deaths continued to increase. And in recent years, there was a shift to heroin. And it wasn't until later that we realized that it wasn't just pure heroin that was killing people. It was actually heroin that had been adulterated with other substances such as illicit fentanyl. Now, this is just one example where death certificate data can allow us to get a better understanding of what's really happening. And the beauty of this data source is that we've been collecting it for hundreds of years, and that whatever cause it is that you care about, you can see it through the eyes of the vital statistics data. The reason why we're here is that improving the timeliness and the accuracy of drug overdose data is primarily an information flow challenge. And we see HL7's fast healthcare interoperability resources as an important part of the solution. So my role at the Centers for Disease Control and Prevention and the National Center for Health Statistics is to try to bring together disconnected communities to think in new and creative ways about how we can solve this challenge. And early on, it occurred to me that if we wanted to improve the timeliness and the quality of the data, we really needed to enroll those people who provide the data to us. And we had to look at it through their needs. And we had to think about how do we provide them the information at the right time so they can make this important diagnosis. So here's a very high level of how death flow and end up on a death certificate and ultimately get aggregated by the National Center for Health Statistics. You'll notice that it's a bifurcated system. Depending on where you die and how you die, your certificate will be filled out by either a medical examiner and coroner, if it's a sudden and unexpected death, or a physician if you die of natural causes. Additionally, the funeral home and your surviving loved ones will provide information about your demographics, such as where you worked, where you lived, who your parents were. All of that gets aggregated at the state level, gets exchanged intrastate and across state boundaries, and ultimately gets aggregated by the National Center for Health Statistics, where we take the literal text that's written on death certificates, code it according to the international classifications of diseases, and send it back to partners who use it to try to solve the challenges in their communities. So our first step in thinking about how to approach this was to model after what the Argonauts did and the Da Vinci Project did and others in the FHIR community are doing. And we gathered 6 states, one of which is with us here today: California, Florida, Georgia, Michigan, New York, and New Hampshire. And we said, what if we could take the electronic death registration systems that are the workhorse of providing these data to our country, and knowing how they're encumbered with legacy technology, could we just add an application programming interface to them that would help to meet the needs of those people who are trying to decide how best to respond to this crisis? And luckily, we were provided funding from the Patient-Centered Outcome Research Trust Fund to be able to go on this journey. And the overarching goals of this was really, how do we get the information to the people who need it in a way that it can be reused for multiple purposes? We didn't want to just move information from point A to point B. We wanted to have an architecture that could serve as the backbone for our nation's vital statistics reporting capabilities. So the first step was to look at the standard death certificate and figure out how much of it could already be represented in FHIR resources. And you can see from this that a great deal of it was already mapped out for us. Then we started to experiment with tools like, then we started to flesh out those resources a little bit more and begin to build the draft profiles. And with that underway, we were able to start to develop some smart on FHIR tools. And here's where we worked with the MITRE Corporation and Georgia Tech University, and they began to show, through these proof of concept applications, how you could fetch information from a decedent's health record and present it right there when the clinician was signing the death certificate. So that way they didn't have to interrupt their workflow and try to remember what Mr. Smith's health history was. And when the VA announced that they were going to open an API management platform, we jumped at the opportunity to work with them. And here's an example where we took that Smart on FHIR tool and adapted it so it can run in any context. It could really run off of any server that supported FHIR. And now I'll hand it over to Steve Wurtz, because Steve represents the state of New Hampshire, and they're one of the first states that said that they're committing to take these types of tools into production. Steve?
Yes, thank you, Paula. Thank you all for allowing me to show you today probably the most innovative way to upgrade a process that's been in place for 200 years. This is not your grandfather's pen and paper transaction. We've, over the years, as a state agency working with the CDC, timeliness has always been the big push. We need to get it. We need to get it fast. We need to get it. We need to get it. And believe it or not, getting it fast was the easy part of what we do. Through initiatives from the CDC, we've been able to form we have a web-based application that's been collecting electronic death information for the past 15 years. Getting information fast to the CDC became no challenge for us any longer. The challenge was the quality of the information. I'm 65 years old. I was at my medical doctor's office last week. My file is about that thick. When I die, there's a very good chance right now I'm going to have a one-line cause of death. There's actually 7 lines on the death certificate for where a physician could add conditions. And that's wrong. Clinicians are very busy. They don't have time to go back to that medical record to check to see everything that I have, nor do I expect them to remember every one of my problems when historically, a funeral director says, here, sign this death certificate because Mr. Wurtz has expired. What we've done is taking our electronic death registration system and turned it into a complete mobile app, 100% mobile app. And what you're seeing there is now this app. It's called the Electronic Certification of Death app. And this was written by New Hampshire for the purposes of certification of death. With a username and password, we can authenticate into the application. And I just want to show you where the practical side, where the real work is being done now from the use of FHIR-enabled applications. This is our system. This is in place now. If I was a physician, and if you see on my screens there, there's a pronounce and certify icon on the top right, and it has a little number 1 on it. That means I have a notification that's been pushed to me as the certifier requiring cause of death. It could be pushed by the pronouncing registered nurse. It could be pushed by the funeral director. But what I'm going to show you today here is, here's the record that I find. This is the information on the patient, and again, this has already been pre-populated. It takes about 7 minutes to do this in total. And we go through the process answering the questions based on the standard certificate. This guides the physician through a series of validation queries on how to properly complete that death record. But where we've really excelled now and have adopted this new technology is through the touch of this icon. The system itself allows the physician at the time of certification, whether he's on the golf course or standing there in the emergency room, the ability to see the inside that person's medical record. We've worked with the likes of Epic, and we validated this technology works. And what I'm showing you here today is the results of 2 conditions that are found in that person's medical chart and medications that could be significant in the treatment of this individual over the last few years. We worked with Georgia Tech, who has been able to write the algorithms of the nature of those conditions that would lead up to someone's death. And what we see here today, both for conditions and medication, the information, the data mining of information from the use of FHIR, be able to absorb that and put it in the hands of the clinician who is now responsible for that certification of death. Fast, not a problem. Quality, that's where we're at. FHIR-enabled applications on that common platform dealing with electronic medical records is the future for surveillance and for really good quality certification of death in the United States. Thank you.
Thank you, Steve. If we could switch back to the slideshow. Thank you. Now, as Steve mentioned, providing the certified information from the medical record is incredibly important. But when you're trying to deal with drug overdose deaths and other deaths that medical examiners and coroners certify, they actually rely on information from a number of different places. So it could come from the death scene and what law enforcement gathered. There's a great deal of information that comes from the autopsy reports. And most importantly, for drug overdose deaths, toxicology labs. Now, if you put your hat on and pretend that you're a forensic pathologist, that information comes in at different times and in different ways, and it's very frustrating to try to piece it all together and update a death certificate and try to figure out what it was that really happened. So as part of this implementers community that I mentioned earlier and which Steve is part of, we have these 6 states that are identifying their priorities of which pieces of this information flow they want to focus on first and how we can use FHIR to better enable more coordinated and consistent ways of reporting this information, not only to the National Center for Health Statistics, but to our public health and public safety partners. These are the basic questions and the way we're approaching this as a community. It's very much a learn as we go process. Luckily, we don't have to reinvent the wheel here. There are many people who have gone on this journey before, and we're learning from that process. And we hope that we're at a point in the not too distant future where those of you who have a great deal of expertise on how to build these types of applications can come along with us and to help us strengthen the capacity and the capabilities of our public health reporting systems. Thank you.